And Doctor, we want to dig in a little deeper into how coronavirus spreads and the new variants that we've been hearing about. So there are now 3 cases of the South African variant in the U.S. And Jason asks, which new variant is worse, the UK, South African, or Brazilian?
Very good question. The most data we have is on that variant that came out of the United Kingdom that's been running rampant in that country and that we're seeing more of here in the United States. We know that it's more transmissible, we think that it's deadlier, but we also think that the vaccines that are currently available will work against the UK variant. We don't know as much about the South African variant, and data does suggest that the vaccines that we're using now may not be as effective against the South African variant as they are against other variants, but still enough to hit that threshold that will actually keep the virus at bay. But as you can see, there's still a lot to learn. There's a Brazilian variant out there and more that are likely to emerge, so we've got to keep our eyes on it.
So what can be done?
Right. It's a great question. Well, first of all, we need to do more surveillance, looking for these variants, looking for the ones that already exist, looking for ones that might be emerging here in the United States, and the U.S. government says they're going to do that. We also know that Moderna is working on a booster shot that could be used to enhance our immune response to the South African variant as well as to other variants. Of course, we need to continue to mask and socially distance, and then we need to vaccinate as many people as quickly as we can, because the more we vaccinate, the less place the virus has to go. It's not going to spread as much, and therefore it is much less likely to create mutations and other variants.
Well, and Dr. Mallika Marshall, thank you all this year for your expertise. It's been so reassuring to know that we can count on you and all of your information. And all this week, Dr. Mallika is going to be looking into what we've learned about this virus. Tomorrow, who gets sick? Wednesday, the treatments which have been developed. On Thursday, we'll take a look at the lasting effects of the virus. And then on Friday, what's next in the fight to stop this pandemic?
It is amazing that a year in and it still feels like we're learning new things each and every day.